DriverCheck. Medical testing and assessments. One phone number, one stop, one step ahead.
Sleep apnea is a common sleep disorder that causes fatigue. It can have a major impact on the health and safety of your workers and the general public. Statistics from the Federal Motor Carrier Safety Association suggest that nearly a third of commercial motor vehicle operators suffer from sleep apnea. Drivers who suffer from the disorder are 2 to 7 times more likely to get in a crash, and the Canadian Sleep Society reports that sleepiness or fatigue plays a major role in about a quarter of all major motor vehicle accidents. Sleep apnea is also linked to many serious health issues, including hypertension, diabetes, and heart attacks. Sleep apnea is characterized by abnormal pauses in breathing during sleep. This is what an airway without sleep apnea looks like, and this is a patient with sleep apnea. You can tell that their airways are different. The airway of the patient with sleep apnea collapses multiple times each hour, resulting in reduced oxygen intake and broken sleep. This leads to daytime sleepiness and fatigue. Many of the symptoms or signs of fatigue are similar to the effects of alcohol consumption. Some symptoms include drowsiness, falling asleep at work, or exhibiting automatic behavior, delayed reaction times, irritability, and a short attention span. Don't let these signs and symptoms go untreated. To ensure your workers do not suffer from fatigue, are healthy, and don't pose a safety risk, sign up for our sleep apnea testing program. This tutorial will show you how it works. The first step is to create a policy that sets out your company's responsibilities. The one we provide you with was developed by a leading Canadian labor law firm and will help protect your company from human rights violations. To make sure your workers get the most out of the program, we educate and train them on the process. We also educate them about the warning signs of fatigue, along with counter-fatigue measures, and provide tips for sleeping better. To determine if your worker is at risk for sleep apnea, he or she will answer a series of questions about their sleep and health. Objective body measurements will be part of this questionnaire. Once it is completed, the questionnaire is evaluated and the worker's status is determined. If they get the green light, their probability of having sleep apnea is low, and no further testing is required at this time. If their status is yellow, there is a risk of sleep apnea, and the employee requires diagnostic sleep testing to confirm the presence of sleep apnea. If they are given a red light, the employee has a high risk of sleepiness and requires urgent follow-up. With a red light, they should not perform safety-sensitive work until their status is reviewed. There are 2 main types of sleep studies that can help determine if your worker has sleep apnea. The portable test is convenient and easy. It will be taken home and returned the next day. This test screens for moderate, uncomplicated sleep apnea using equipment that monitors breathing patterns and the heartbeat. The overnight test is taken in a private bedroom at one of our sleep clinics and diagnoses various sleep disorders in addition to sleep apnea by monitoring brainwave and leg muscle activity, chin muscle tone, eye muscle movement, heart function, breathing patterns, and blood oxygen saturation. Once the result from the sleep study is in, a sleep physician will meet with the worker to review it. Remember, sleep apnea is highly treatable. Positive airway pressure devices are the most common form of treatment. These are mini compressors attached to a mask that blows air into the airway to prevent blockage. A specialist will meet with the worker to teach them how to use the device. As soon as treatment begins, a compliance coach will contact the worker regularly and will track compliance using data cards or a cellular network. If the worker has any questions, requires advice, or needs help with their equipment, they will have access to a 24/7 live coaching service. For more information, visit drivercheck.ca or call us toll-free at 1-800-463-4310.